The Acute Care at Home service offers hospital care for frail older patients in their own homes or in nursing homes. We are all aware of the increase in the frail older population, many of whom have multiple long-term conditions including dementia. A hospital admission can be traumatic for anyone, but particularly for frail older patients. Hospital admission can also be associated with an increased risk of delirium, falls, hospital-acquired infection and increased dependency. This is the first consultant-led service of its kind in Northern Ireland, and the team includes consultant staff, an associate specialist, a pharmacist, a physiotherapist, an occupational therapist and specialist nursing staff. We accept referrals from general practitioners, the Northern Ireland Ambulance Service and the Acute Hospital. We aim to respond within 2 hours of referral. These patients have the same access to diagnostics as if they were in hospital. The service has been running for approximately 1 year, and in that year we have prevented 400 hospital admissions and facilitated earlier discharge for approximately 100 patients.
As soon as I arrive at a patient's house, we begin our holistic assessment. This is to accurately and completely meet the needs of our patients who are admitted to the scheme. This may involve the taking of bloods, which are then transported to the lab urgently. We perform ECGs, we're able to do point of care testing to determine arterial blood gases, carry out bladder scans if necessary and record our clinical observations. All this assists the consultant in a timely prescribing of the most appropriate treatment. The full-time pharmacist within the team is then able to help us access the drugs in a timely manner and for us to begin the patient's treatment plan at home. This could involve the administration of IV fluids, subcutaneous fluids, IV antibiotics, IV diuretics and IV steroids.
Dad took another one of his seizures on the Friday, and it was worse than ever before. He actually was going unconscious, so we had to phone 999 and the ambulance team arrived out. They gave us 2 options, either the new service or Dad to go to a hospital, which I didn't want with him being a dementia patient, especially in the latter stages. And the team, the doctor and nurse arrived out within 1 to 2 hours, done all their tests that they would normally do in a hospital, and they were satisfied that Dad wouldn't have to be hospitalised. The pharmacist was sent out as well, and OTs arrived out. They were excellent. For the week after we made the phone call, the service that we got was out of this world. I can't recommend it enough, and didn't know that it actually existed. And especially for elderly and dementia patients that you don't want to send to a hospital, you want to keep them in their own home, in their own environment.
One of the things that we've been very impressed with has been the speed at which we get to talk to a consultant and hand over the care from general practice to this new team, and then also the feedback that we get from the team at the end of their involvement with the patient. It's very interesting to see that we're getting very positive feedback from patients and from their relatives, and in fact we're now being asked by relatives, would it be possible for the Acute Care at Home team to see my relative and try and keep them at home? So I think that speaks volumes about the quality of the service. Integrated care partnerships were set up under Transforming Your Care, and the Acute Care at Home team is an example of how transforming people's care and moving it from the hospital to their own home can be supported through integrated care partnerships.
Really my role would be to come out to the patient's home and assess them in their own home, to best suit their needs, and this might include aids and adaptations to make life easier for the client and the family. It would be to try and promote independence and enhance their quality of life. Part of my role would be to complete cognitive assessments and liaise with the memory team. Treating somebody in their own home with dementia helps minimise disorientation and confusion. I would look at social participation, I would look at their routines, their daily tasks, and I would try to ensure that the patient with dementia is getting enjoyment from their daily activities and their hobbies, and that they are living life to the full.
This is a truly innovative service, and for the first time in this area we can provide acute care at home for our frail older population. The service has undoubtedly reduced the pressure on the acute hospital, but more importantly, it has resulted in a much improved patient experience.